Welcome to Think Like a Pancreas, the podcast. Our goal is to keep you informed, inspired, and a little entertained on all things diabetes. The information contained in the program is based on the experience and opinions of the Integrated Diabetes Services clinical team. Since this is a very individualized condition, please check with your healthcare provider before implementing any of the weird stuff we may happen to share with you today.
Hi, I'm Alicia Downs, RN, MSN, CDCES, BCADM. So I'm one of the nurses with Integrated Diabetes Services. And we've got Jenny. Jenny, go and introduce yourself.
Sure. I'm Jenny Smith, and I'm a registered dietitian, certified diabetes care and education specialist. I've been with Integrated for almost as long, or a little bit longer than you, right, Alicia?
A little bit, yeah.
A little bit longer. But we have a group of lots of women in our office. And in terms of, clinical staff, I think Gary is really our only high testosterone. And in that same line, Alicia and I feel very strongly about women's health issues because there's a lot that is not talked about, poorly understood, and people sort of just get well, that's just what's supposed to happen, right?
Yeah. Yeah. I have a passion for women's health just from my own journey. I think that's where, as a nurse, my complex medical history, as a diabetes educator, a person living with diabetes, and then women's health, my own journey through women's health has not been, I would say, has not been typical. But what I've come to find is that it has, in fact, been typical. It's just that the textbook is bunk.
Right.
And therefore I was led to believe that the norm is a fairy tale. It's like
Absolutely.
Disney wrote like what we know is like women's health and what is normal. And so I really had to do my just like with diabetes, I had to do my own self-education because my clinicians, come to
Didn't know
find,
enough.
yeah, really weren't particularly educated.
Yeah.
And stumbling across the occasionally really well-educated clinician wasn't sufficient. I had to really cobble together my own
Right.
knowledge base.
And it's frustrating because, not growing up with issues in terms of my own like female cycles and those types of things. It really wasn't until I delved into the world of getting ready to try to have a child that I realized how lacking our current system really is. I mean, even with type 1 diabetes, going to my endocrine team and saying, hey, we're planning this, what should I really be prepared for? Well, you should be prepared for changes in your blood sugar, and your insulin needs are really going to rise. That's pretty much the 2 seconds that I just said there. That's what I was told. And I was like, well, it seems like there's going to be a whole lot more that's going to shift over this like 9+ month time period, that things are happening in my body,
Yep.
right? And nobody could prepare me for that. And I was really frustrated as well in once I was pregnant, how much I was thrown into the bucket of the information that we have for those who are not well managed in pregnancy with type 1 diabetes. And that was not me.
Yeah.
I had fully prepared. I knew what I expected to kind of happen from the research that I had personally done because nobody gave it to me. Again, frustrating. And so I'd go to my visits and they'd say, well, you're like, well, I don't even, you wouldn't have to be here if you weren't high risk. Like, we have
Yeah.
nothing to help you with. And I was like, well, that's not helpful. Like, right?
Yeah. And we are often looked at as women in our medical world. I mean, just from the medical perspective in general, all of these sort of averages, the standards, the norms, the typical within normal limits, those are all based on 35-year-old Caucasian
Right.
males. Women weren't even required to be fully represented in medical research and pharmaceutical clinical trials until the mid 90s.
Yeah.
I mean, we're talking less than 30 years of appropriate representation. So we're talking like, I mean, I was already in high school.
Mhm.
So like a good chunk of my medical
Yeah.
world was done with total blinders on as to my actual medical needs.
Absolutely.
And so, my doctors were coming up with training that was not based on accurate medical knowledge of the
Mhm.
impacts of pharmacokinetics and what medications were actually doing and what diseases were actually doing to the female body.
Mhm.
And we're often looked at as there's like this nebulous time of stuff, pregnancy and reproductive years, and then this nebulous time of stuff.
Right.
And only during our reproductive years is there really any real
Information.
science, right?
Mhm.
And then when you then layer diabetes on top of that, the only information there is information of if you're wildly out of control, if you're wildly
Right.
unhealthy.
Right.
So it's like
Absolutely.
there is just nothing to go
And
on
it's
for anyone else. That
there
that
isn't.
represents of the
Mhm.
1% of the population that has type 1 diabetes, of the 50% of those that are female, of the 15% of those that are in their reproductive life. I
Right.
mean, what there's information out there for like 9 people? Like, like how many
Right.
actually are getting useful info there? The rest of us
Exactly.
are living the rest of our lives with just total blinders on because it's it's supposed that your female health only impacts pregnancy.
Right.
When let's face
Absolutely.
it, like if you actually take into account, okay, as a as a as a sort of adult-ish female, as a post-pubescent female, I
Mhm.
mean, I am menstruating 20% of my life. I am premenstrual roughly 15% of that time. I am postmenstrual 15% of that time. That is 50% of my time that I am not hormonally and therefore glycemically speaking normal.
Right. And that's the confusing thing, especially once you bring in diabetes, whether
Yeah,
it's type 1 or type 2 diabetes, when you bring that into the mix of something that's already poorly explained. And I
yeah,
I firmly believe and try hard when I work with like the teenage population, right? And it's mostly parents of the teens.
yeah,
But it's explaining to them, well, why do things look so wonky? They're all over the place. I can never get a handle on it. She needs more, and then she needs less, and then it's all over the place, and we don't know what's going on. And I was like, well, how about we start tracking some things, right?
yeah.
Around a cycle. And it's like a light bulb that goes on. Oh, well, maybe that does have something to do with it. So when we layer on top of just overall poor information starting in the early years when girls coming into that sort of pre-puberty time and then the teen years and even the early 20s, which can still be a little bit fluxing,
Very.
there's very little education that's done. It's the baseline education is you're a girl, so you'll have a period, and we don't want you to get pregnant. So try not to do this, or this is how to prevent it, or we're going to start birth control. I mean, that's the
And again,
extent.
it's like your being female is just surrounded around reproduction.
Correct.
Like,
Yes. When in fact, the hormone cycle it's a full, like, let's call it 30 days, right?
yeah,
28 to 32 or whatever it is, just average 30-day
yeah,
cycle. And in that cycle, the hormones are always fluctuating.
yeah,
They're flatline, they're rising. Certain ones are rising, some of them are more stable, those drop
yeah,
off, other ones rise up. And again, with diabetes, that has a very direct impact on
It
what's
really
going to
does.
happen to your blood sugar and your insulin needs and other medications and how they work or get absorbed. I mean, it's,
And your emotions, and we all know
yes,
stress has a massive impact on blood sugar. If I'm PMSing and I feel like I'm going to weep for no reason or scream for no reason, that emotional lability is going to have a huge impact on my blood sugar.
yes.
It's
Hmm.
and we can't just brush that under the table because we're not comfortable
No,
with the conversation. And like as an endocrinologist or diabetes educator, we can't ignore it or say, go talk to your GYN, because then
right.
the GYN says, I don't know, I'm not an endo. And so now you've got a patient just,
In flux, in
yeah,
this middle ground where this doctor told me that they can't really discuss that or they don't know enough.
right.
And this doctor says, well, go back to the other doctor because this is more
Yeah.
in the realm of this. And again, none of them are really knowledgeable enough to say, hey, this is what you should expect. And again, with diabetes, that's where I think the conversation, as uncomfortable as it might be to sit down with a teenage female and say, hey, this is what's going to happen.
Yeah.
It may be irregular. If blood sugars are irregular, your cycle might be more irregular. So we're going to try to navigate this together. And I know it's weird to talk about. This is important for you to know. So going forward, as an adult, you know what to plan for, even if it never includes wanting to have a child.
Yeah.
This will help you understand why things are fluctuating the way that they are and how to work it.
And I tell my young patients, like, real talk, diabetes, we're talking all the time about blood and hormones,
Yeah.
blood sugar, insulin. Let's talk about your period. It's blood and hormones, estrogen, progesterone, and menses. Like,
Yep.
why is that weird? Why is it totally socially acceptable for us to talk blood sugar in the produce aisle at the grocery store, but to talk menses is like,
It's like,
hey
oh,
guys,
right,
50% of the planet's doing it. Like
right. Exactly. At
at
any
any
given
given
point.
time,
Yes,
whatever woman you're talking to at the bank
could be.
probably participating.
Yes, exactly.
Like maybe if it wasn't so taboo, we'd have more science.
I think that's it. And, it's unfortunate that even with in the past 10, 15 years, a little bit more, visibility and whatnot, sure, to evening of the ground between male, female, so to speak, this whole topic around this hormone cycling
Yeah.
is still very, like you said, taboo. It's still very hard in a conversation. Nobody wants to hear about a women bleeding.
Yeah.
Right? Like
I think
nobody wants to
I
touch
think it's
it.
hard. I think it's hard on one side because it's been a thing of that women were supposed to not talk about, and it was in some
Right.
cultures it's a thing that's very protected, and it's a very special time that's supposed to be
Hmm.
honored and
Hmm.
treasured and kept very sort of sacred. And
Yes.
in others, it's a thing that's considered unclean and shameful and not to be touched. And so
Right.
there's a lot of, on both sides, there's just a lot of silence that can lead to a lot of stigma and taboo. But then I think in our sort of Western, very sort of American post-feminist revolution, I think there's this thing of like, well, if we're going to be equal, then we all have to kind of come at it the same, which means women have to pretend that they don't have periods and they don't have
Right.
hormones and they don't have. I'm like, well, why don't we just pretend that men do? I
Right.
mean, because like we all, if anybody really pays attention, men kind of menstruate. And, you know, so like, why don't we all just pretend that our hormones swing and fluctuate and affect our world? Because the reality is they do.
They
Like,
do.
you know, men have
Absolutely.
ebbs and flows in their hormonal cycles that affect their energy levels and their confidence levels and their body image levels and things like that as well.
Absolutely.
I think if we all kind of tuned into that, it would be better.
Right.
I think another thing that we really don't get data on is outside of that, even things like, for example, we know women are more prone to UTIs,
Hmm.
just the structure of our
Yep.
urinary structure. Um, and things like when we get UTIs, because we urinate out more glucose than not women who don't have diabetes, often it will take more than one round of antibiotics to
To treat
fully
it.
clear a
Mhm.
UTI, right? So we get one round, we become non-symptomatic. So the pain goes away. So we think we're good, but our blood sugars don't normalize. The blood sugars stay high and erratic. We might even still have ketones. And here we are about 2 weeks later, symptoms
It's
start
still
coming back.
there. Mhm.
And so we get these UTIs that are really difficult to treat and can really become problematic. And we can end up going from UTI to bladder infection to
Mhm.
renal infection to, I mean, really a health crisis. Same
Right.
thing with like a yeast infection.
Yeah.
Yeast infections, again, because we're urinating out glucose and the genitals and the urinary tract are all right, just right there together. We're feeding that yeast infection the
Yes.
sugar that it makes it grow. So yeast infections, first of all, ladies, moms of littles, okay, moms of little girls with diabetes, bubble baths. Bubble baths are like problem number one. If you really want your little girl to indulge in the joy of a childhood bubble bath, make sure she is you're rinsing post
Clear. Yeah.
really, really well. Make sure you're teaching little girls to wipe front to back when they use
Yep.
the bathroom, please, 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 to avoid infections. But um, if their blood sugars are high and erratic and you're not really sure why, yeast infections are so common in little
Mhm.
girls with type 1
Mhm.
diabetes. But skip the Monistat, skip the Vagisil, all that over-the-counter stuff. That stuff's great just for comfort, but it
Right.
is not going to work in a woman with type 1. It's just going to get you asymptomatic.
Mhm.
It's not going to treat it. And again, we usually need 2 rounds. I always tell any woman with type 1, if you're on an antibiotic, that's another one, ask your doctor for 2 rounds of the fluoxetine or the diflucan pill.
Right.
Take one, wait 7 to 10 days, take the other one, even if you're asymptomatic, because it's going to take the 2 rounds. Otherwise, symptoms go away, but your blood sugars are going to
Don't
stay
come
high.
down. Mhm.
And
Which
boy,
is kind of a cyclic nature too. I mean, the
yeah,
high blood sugars are not helping
right.
clear it from the first round anyway. And so then, like you said,
Yep.
you may be asymptomatic, blood sugars are still high. That's a lot of the questions I get from women who are like, I was treated and my blood sugars are still high. Has something just shifted now because I was sick? And I'm like, no, is something still hanging on there? We need to
Yeah.
like reevaluate, go back to the doctor. Like you said, you're
Yeah.
very likely to need another round of
Yeah.
management.
And if I always tell patients, if you've had the first round, like if it's a UTI, you've had that first round, your blood sugars are still running high, especially if you're still passing ketones,
Mhm.
ask them to do a CNS, a culture and sensitivity. That way
Mhm.
they can check and make sure they've got the right antibiotic for the right
For the right.
bacteria.
Mhm.
And because you don't always just want to go broadband, because that can be problematic because we are more prone to UTIs.
Mhm.
Using broadband all the time can be problematic. Ask your doctor that for that second round to get specific on that
Mhm.
second round. Don't just broadband it. Tighten in their scope. And that way, you're not always just hitting your body with that broadband antibiotic. You want to
Well,
keep that
and
one in
unfortunately, if you're
store.
prone to them too, and you're always using that broadband, your
Exactly.
body's not going to respond then because it's
Yeah.
been treated with everything and
Yeah. You want to
it
keep
just
that
never
broadband in your back pocket for pneumonia or MRSA
right.
or like when
Something
the big
really,
baddies hit.
yeah.
Yeah, for UTIs, we want to keep it dialed in on the ones that are specific to what we've got going on. But
Right.
that double round, I mean, I have had patients that have ended up months and months and months of just, and they'll go UTI, high blood sugars, yeast infection, high blood sugars,
Mhm.
UTI, and their doctor's just treating them one round on each. And they're like, my doctor's not listening. And I mean, 4 or 5 months. And now they end up with like scarring and damage and just
Yeah.
massive like skin, because a yeast infection doesn't seem like a big deal, but if it's going on and on, it can
It can
really
be,
be very, very
yes.
damaging. I mean, it can lead to pelvic inflammatory disease and stuff like that if it's really
Right. If it's
ravaging things. So
left.
So really, and I would say talk to your doctors in advance when you're healthy. Have
Mm-hmm.
the conversation. Hey, I have type 1, and so here's what I know and what we see. So can this be the plan of treatment when these things happen? That
Right.
way they know that they're not just dealing with somebody who's like upset and uncomfortable and wants to just do everything in the moment.
Right.
They know, okay, we've had this discussion already. Here's the plan. Boom, and they just enact it.
Yep.
So,
And I think, I mean, you bring up, the younger generation, but I think as well as women age and get beyond the childbearing years, moving into perimenopause, menopause, the changes in moisture level and the changes like that can also bring about a time of more infections, more prone to infections, big shifts in blood sugar levels because hormones are shifting in a very downward and
yeah.
different way than a woman has grown used to, right? And that can be another time of very significant confusion. Because again, I think of any of the stages of life, perimenopause and menopause are, I feel like doctors, without doing it, sort of you ask the question and it's almost like their hands just get thrown up. And they're like, well, this is the stage of life that you're in, and this is what's supposed to be happening. But no, you haven't defined that what. You
Yeah.
haven't defined how should I navigate through this? And then the layer again of diabetes. What should I expect?
Yeah.
I'm seeing irregularity. I'm seeing shifts that I can't any longer spot a cycle coming, right? I was
Yeah.
used to this happening and it's not really happening anymore every single time. And that's where the hands go up and they just sort of tell you to work it as you work it. That's
And
not
it's
helpful.
and it's terrible because when you come, hopefully, I mean, it's definitely not true of all young women.
Right.
Some of us have very difficult journeys, but generally, coming through puberty, it's a
Mhm.
time of at least, I mean, at least now in public schools, there's education,
Right.
and you've
Mhm.
got parents or caregivers, and then you come through your childbearing years, and hopefully you've got, again, relationships around you
Mhm.
that are supporting and encouraging. Perimenopausal years is a time in life when you are kind of expected to be self-supporting, self-sufficient
It's
on your own.
lonely.
Right. But
Mhm.
the reality is that most of us have far fewer friends.
True.
Um, a lot of us in our modern world are single or divorced, or, we're
Yes.
in our careers, or maybe even retirees at that point. We might be empty nesters. We're just going through transitions in life where we just have fewer and fewer
Right.
supports and encouragements. And all of a sudden, I've been doing diabetes for decades, and all the things that I've been doing start failing me. Like, I
Mhm.
thought I knew what I was doing, and I'm failing, and
Right.
it's getting worse.
Worse.
And
Mhm.
I'm gaining weight, even though I'm working out more than I've ever worked out in my life.
And I'm
And
eating less and my appetite
right,
isn't the same.
right.
And right,
And
it's
my cholesterol's going up,
up.
and
Mhm.
my blood pressure's going up, and my vision's getting worse.
Worse.
And my doctor just handed me another diagnosis and another pill. And so it's like my self-image is steadily crumbling.
Yep.
And here's just my diabetes, this thing that I have worked so hard
To
to
understand.
to
Mhm.
build and to maintain, that is just like defying all logic in the middle of it. And I go to my doctor and I go, help. And they go, and so many of our doctors, we're going to our PCP going, help me with my weight. And they're going, just move more and eat less.
Right. And it's
And we
not
go to our GYN and we're going, I can't enjoy, like, I love my partner, but I don't enjoy sex the way I used to. And they're going, well, just use more lube and take more time and get him
right.
some Cialis. And you're like,
You're like,
and
no,
we
see,
just
that's
get
not.
we just get so many like pat on the head, move on, or like you're just getting older, and you're like, I'm only 43. Are you telling me the next 50 years of my life. Like
Are going to be,
I'm not even to the halfway point yet.
right. Yep. Yeah,
So,
absolutely.
so you don't have to accept that because that's not the reality.
Right.
None of that is normal aging. And the reality is the answers that you're getting are from people who don't have the humility to look at you and say, we don't know because science has ignored you for too long. What we do know is this. And so let's
Mhm.
look at you as an individual and make your situation and your body the science
Mhm.
and study that and figure out what's going
And
to help you.
let's work together,
Yeah.
right? I mean, that's really, I was listening not too long ago to another podcast that was really talking about women's hormones, especially coming into, this later life, kind of
Mhm.
past I want to have kids or I never wanted to have kids, and now I'm moving beyond that sort of time period and what to expect. And we really, every day we're moving forward in age, right?
Mhm.
And so we should know that, as you mentioned early on, some cultures actually treat this time of a woman's life with a lot of respect
Yeah.
and a lot of understanding that this is how it is supposed to happen.
Yeah.
Your body is supposed to move through these changes, and some cultures support it very gracefully. And the woman feels very happy and healthy in this change in life, wherein again our more westernized, I would say even Americanized, quite
Yeah.
honestly,
Youth
culture that we
obsessed
have, we
culture. Yes.
we are. And so we feel like once we get to 45 plus and these shifts may start happening, especially with diabetes, women end up moving into perimenopause and menopause sometimes earlier
Mhm.
than women without diabetes. And so what we
Especially
see,
glycemically. We
correct.
often see it glycemically. Women are like, well, no, I'm still getting my menses. Maybe it's not as regular as it used to be, but I'm still getting it. But
Right.
our blood sugars will usually tell us what
That
is going
things
on
aren't the same.
years before what's happening. Like what
Yes.
I can usually let a parent know that their daughter is going to start her menses months and months before it actually starts happening because we start to see those
Cyclic
premenstrual
patterns. Mhm.
patterns emerge way before we actually see menses
Right.
onset. And so again, we start to see peculiarities of insulin need
Right.
months, years before we
Mhm.
see menses or
And
menopause actually start to
and sometimes
emerge.
it's the insulin amount, right?
Yeah.
Where you said,
Yeah, it's
you
usually
might
that
be
total
doing
daily dose starts going
starts nudging.
wild. Like,
Mhm. Despite not changing any other variables in your life, you're all of a sudden more resistant. You
yeah,
need more insulin. And
yeah,
it's odd how your blood sugar reacts to typical foods and the things that and exercise every day used to do this. And I don't
yeah.
think it's helping as much as it used to help me. And again, these are all changes that should be coming, like, even without diabetes. A female body should be moving through these changes, but I think we're so focused on remaining the way that we were
Yeah,
that it's hard to see that it's okay that you're changing.
right.
It's okay that you're moving into this time of life because that's what should be happening. And I think women they're too focused on trying to retain I'm 30,
Yeah.
and that moves people into considering some of the, and I truly believe that HRT is beneficial for those that really
Mhm.
need it. But I think it's one of those things that's sort of a band-aid thrown into the mix
Right.
when somebody comes into a practitioner with complaints, let's call them, or
Yeah.
or concerns, and the first response is, well, let's just try this because this
Right.
will take care of all of the insomnia, it'll take care of the hot flashes, it'll take care of the skin changes and the how your anxiety level is and everything. They throw it all in the basket. Well, that may not be the tool that you needed.
Right.
Something else may, and or maybe just the discussion that, hey, you know what? You're supposed to be moving into this time of
Right.
change. And while we don't really, like you said, we don't really understand it as much as we should because we haven't really studied as well as we should, I'm here to help you move through this.
Yeah.
I think a lot of women
Sometimes,
just want a hand holding them.
yeah. Sometimes the acceptance of our bodies, sometimes the anxiety and the nausea, or the anxiety and the insomnia and the the depression and the some of the weight gain, and a lot of those symptoms are the fighting against
Yes.
the reality of my body is
Aging.
changing without my permission.
Right. Yes.
And it's not even that I'm getting older, it's that my body is changing without my permission. That my whole life I have actively worked to make my body be what I want it to be. And now, despite my best efforts, it has decided that I am no longer the
Right.
captain of that. And that is really,
It's
really hard for a
frustrating.
lot of us.
Yes.
And it's hard. And that is the story of kind of the rest of our lives.
Mm-hmm.
Is our body time progressively and progressively telling more of that tale, and us having less and less of a say so. But I think that when we can change that mindset to one of a beautiful acceptance and a
Mm-hmm.
partnership with our bodies, when you meet people who have done that and they say, no, I'm going to embrace the beauty and the wisdom and the grace and the flexibility that comes in
Mm-hmm.
that's when you meet the people that are like yogis in their 90s,
Right.
and they're like
Yes.
runners in their 80s, and because they're not wasting all of their time and energy trying to be someone they can't be anymore. They're
Right.
just focused on taking what they have and just exploring who and what this new body can really be.
Right.
And that's when it comes to blood sugar, I see the same thing. I see a lot of patients say, I've gone from 30 units a day to I'm up to almost 50 units a day now. Oh my gosh, how do I get that back down? And I go, well, but your blood sugars are good. You're
Right.
85% in range, and standard deviation's 32, and you're very rarely you're very rarely above a 160,
Right.
and you're no hypos, and you're not having to work really hard to do that. And so
So
what's the
let's not
focus on the
worry
total
about that.
daily dose? They're like, well,
Right.
if I have a lot of insulin, I'm going to start gaining weight. And I'm like, well, I mean,
But
part
but you're not,
right.
right?
I'm like, but you probably will gain probably
Some.
5% body weight. That is typically that is developmentally appropriate. We say that with children, right? At what point do we stop saying that? If
Mm-hmm.
my 7-year-old son gains 15% body mass, that is developmentally appropriate for him. I wouldn't
Right.
be upset. And therefore his insulin needs should also change accordingly. I, as a 43-year-old woman, should see a shift in body mass from my 40s into my 50s.
Mm-hmm.
That is developmentally appropriate.
Right.
And therefore my insulin needs should also shift. That's
Mm-hmm.
developmentally appropriate. And then
Mm-hmm.
as I shift from my 50s into my 60s and through my 70s, I should actually then see another shift down. I should see a shift from lean muscle mass shifts down, fat mass shifts down, insulin needs actually
Mm-hmm.
then shift down. So if I
Down. Mm-hmm.
actually don't see that shift up through my 50s, I might actually end up underweight
Too
in my
lean.
70s,
Mm-hmm.
right? And I might be too lean and have a lot of health risks there. So
Mm-hmm.
keep in mind, as women, we are growers and developers.
Mm-hmm.
We grew and developed as children. We grew and cultivated other people as younger women. Now,
Mm-hmm.
as we're older women, we now switch back to growing and cultivating ourselves
Yourself.
again.
Mm-hmm.
And that's okay for that
Mm-hmm.
person to grow and change. There's this huge billboard for like a cardiac rehab center for the local ginormous hospital system. And I hate it
Mm.
so much because it's this guy in this like silver fox, like, ha ha, and his like Under Armour, and
Right.
it says, get back to who you used to be.
Oh,
And I
yeah.
hate it so much because every time I pass it, I think, who needs to get back to who they used to be? who you used to be landed you in a hospital bed with a heart attack and a quintuple bypass and in cardiac rehab. How
True.
about you get to who you could be that you
Right.
haven't even met yet?
Well, I think that's an evolutionary, like that's another step in thought, and you have to get there at a mental level to realize again that you're changing, you're moving, we're all evolving, whether you're accepting of it or pushing back against it. And that billboard is kind of the push against that evolution.
Yeah.
It's a push back against, don't you really want to be back at 25 or 30, right? Maybe not. I actually, I quite
For all our
honestly think
listeners who are 25 and 30, it's glorious, it's beautiful. You're
it,
amazing flowers.
it
Bloom,
is.
blossom, and love it.
Yes.
And enjoy it.
I always tell people though, like what, the silly people who are like, oh, what age would you land at if you could just be forever, quote unquote, young, right? And I always feel like 37. That's if number wise, I wouldn't be 20. I wouldn't be 25. Man, I was dumb.
I want to be
Dumb.
9.
At that, you want to be 9.
I want to be
You
9.
want to
You're
have
old
no
enough to stay at,
responsibility.
yeah, you're old enough to stay up past 8 o'clock, but way too young for anyone to expect you to pay your own bills.
To pay, yeah, or understand any of that. That's, yes. I mean, young age, I would agree. Maybe about 10-ish would be really, really lovely. But I think as an adult, there's a lot of intelligence somewhere in the 35 plus years that comes only from life experience. And when you build on that and keep moving forward with the understanding, I am changing. I have to learn how to evolve with this, how to move forward. Women's health includes, unfortunately, a lot of what should be talked about in terms of bone health, right?
Yeah.
You talk about those changes that you should expect, this percent change here, this percent change here. But if we really want to retain bone health, calcium stores and those kinds of things, it is really in our early years that we should focus on resistance training, and we should continue those into the years that we're going through these other hormonal changes, because if we don't, that change from muscle mass post 55, 60 into the later years of life, you're going to be at a much higher risk. So
resistance training is hugely important for women, at adult women, all stages. I can never encourage women enough. Women tend to over focus on cardio, and under focus on resistance training.
Yes.
Resistance training is what is going to keep you heart healthy. It is what is going to keep your bones strong. It is what is going to keep your joints strong. It is what is going to avoid injury. It is what is going to keep you glycemically well. It is what it's, the more we learn and the more studies there are on resistance training, the more important it is. As we age, flexibility and resistance training
are so important. Yes.
Where it's at. Keep your heart moving, but if you're doing flexibility and resistance training, your heart's going to be pumping as much as it needs to pump.
Exactly. Yep.
And you're not going to miss those beats. And getting that in there, getting screenings, double check with your doctors. Having type 1 diabetes means that we might need to use screenings earlier. Things like osteoporosis screenings. We might want to start those earlier. Things like breast cancer screenings, things like cervical cancer screenings, things like, we might want to skew those a little earlier for women with type 1, depending on your family history and so forth. And the screening ages and spacing is always a moving target in women's health. And that's a nice big red button political issue. So talk with your doctor about what's most appropriate for you, but make sure you're asking your GYN, hey, specifically, I'm a woman with type 1 diabetes. Should we be adjusting these times because there is a slightly higher risk for me with this going on? And we haven't even had time to touch on trans women, trans health. Talk about an area with no science.
Right.
My goodness.
Especially,
no science,
and then
no
with diabetes
Yeah.
can be
Well,
very frustrating.
and risks of diabetes. I mean,
Mhm.
trans women are twice as likely to have diabetes as non-trans women, and twice as likely to have diabetes as trans men. So I'm very humbly proud to say that it is an area of personal research that
Mhm.
I have made a point to educate myself in and get my hands on what
What is
scant
there?
data there is, to offer support and to pull together what educated persons in the fields there are. It's really been making contacts with people in the diabetes field, and then in the gender affirming medicine fields,
Mhm.
and sort of bringing them together and going, hey guys, let's put heads together. Like, you guys don't necessarily know each other's fields, so let's come together and compare notes and see where we can learn from
Right.
one another.
And what's missing, what needs to
Yeah,
be
and
added.
start filling in some gaps and just supporting patients, and just kind of sharing patient case files where we can to
Mhm.
learn and
Right.
aggregate data, so we can start supporting patients more effectively, because when we, again, we start taking physiology plus hormones plus diabetes equals a whole lot of variables to
Mhm.
consider.
It does.
And we've got a lot to learn, because we are centuries and centuries behind. We've had insulin for over a century now. We've had females
Yes.
since the dawn of time.
Right. Yes.
We've got some catching up to do.
We definitely have a lot of catching up to do.
So
So, and I think that means we also have more conversations to have about it, because capturing it in a short little blip of time is certainly not enough. So hopefully hopefully lots of questions kind of come to us that we can maybe even include
absolutely.
the other educators in our practice as well, and we'll leave Gary out of it this time.
Yeah, you can head
So,
straight to our site. We're at integrateddiabetesservices.com. You can find Jenny and I there on our About tabs. You can feel free to fire us questions.
mhm.
You can also follow us, obviously, our podcast. Also, I wanted to throw a shout out to Diabetes Sisters. Speaking
Oh,
of
yay.
diabetes and women's health, they're a fantastic organization that really focuses in on the needs of women with diabetes and getting women with diabetes connected.
Yep.
So shout out to Diabetes Sisters. Um, and we work with
Awesome.
them a lot. We do a lot of speaking with their group and
We
supporting
do.
them, and vice versa.
Yes.
So
Awesome.
good talk, Jenny.
Yes. Thank you so
I feel
much.
like
This
this
was
might be
wonderful.
dangerous. When Jenny and I talk, we tend to light little fires, and then little side projects start shooting off.
End
And
up coming up. Exactly. I know we could certainly, with more time, we could certainly talk for probably another hour all about,
oh,
and then
I
just
think,
find more things to talk about. So
yeah, endless.
yeah.
So I
Yeah.
don't know.
Awesome.
I don't know. Maybe there's a book in there somewhere.
Oh, and a book that has not been written, thus like my pregnancy book that nobody put any information together. So there it
There
is.
we go. I don't know. I think it needs to happen. I don't know. Maybe the two super busy moms in the practice maybe shouldn't take that on right now. But
Maybe you shouldn't. No, but maybe we gather some information and then eventually put it together in a book
there we go.
coming. There you
There we
go.
go.
Good
I
idea.
think Beyonce said it best when she said, "Girls, we rule the world."
Without
Thanks,
girls, there
Jenny.
wouldn't be more. Thank you very much, Alicia.